Hi, this is Dr. Bragg with a tip for a pain-free Friday. Today, I want to talk again about comprehensive pain management because so often people come to me, as a man did the other day, and all he wanted was a narcotic pain medication. And I cannot say it enough. Over and over and over again, I need to explain to providers and to patients alike that pain management is not synonymous with just saying you are getting narcotic medication, because that is what led us to the opioid crisis. That is what leads people to overdosing when they have the mentality that pain management simply means narcotics. So I want to use an analogy. I'm sure that for most of us who had the privilege of knowing our grandmothers, we had the opportunity for standing by their side when they made a pie. I don't know what your favorite pie was with your grandmother. Maybe it was a sweet potato pie, lemon meringue pie, pecan pie, or maybe an apple custard or apple cobbler. I don't know. But for the next few minutes as I talk about this, I want you to think about your time with your grandmother as grandmother had you tasting her favorite pie. One thing about it, grandmother had it right, because she knew that her pie was not made with one ingredient. My grandmother's favorite pie was a sweet potato pie, and she knew that that pie not only needed sugar, but you had to put some allspice in it, some nutmeg, some cinnamon, egg, and milk. It wasn't made of just one ingredient. But yet, when it comes to pain management, people want to just have one ingredient, opioids. And I want you to know that comprehensive pain management should be called pain management pie. It should be just like a pie. And you should have several ingredients in your pain management plan. That means that it should not be all driven by opioids. Everybody that has pain management doesn't need an opioid, a narcotic. Some people do. But even if you have an opioid, if it is not improving your function, what good is it doing for you? Because function and pain are intimately related. And if your pain is controlled with the opioid analgesic, then your function should go up. And so you may have an opioid analgesic, but you need to make sure that, are you doing physical therapy? Are you doing your daily exercises? Are you taking injections, using a TENS unit? What else are you doing to control your pain? Because in our pain management pie, you have different slices, and an opioid should only be one thin slice of your pain management pie, where you have anti-inflammatory medications, Tylenol, topical medications, maybe diclofenac that you use for knee pain for people who have arthritis. Maybe you have capsaicin for people who have neuropathic or nerve pain. Maybe you're using a lidoderm patch for people who have nerve pain, neuropathic pain. Maybe you're using gabapentin or Lyrica. Maybe you have to have other medications, injections. But whatever it is, dry needling with physical therapy, massage, all of these are different slices of a pain management pie. And I simply want you to look at, what is your doctor doing? And draw out a pie and make sure that pain medicines and opioid is just one slice, and that you are integrating it and getting other slices in the pie. Otherwise, you're doing yourself a disservice and not getting the big benefit of pain management. And yes, grandmother had it right, because she understood that in order to make a good pie, you had to have several ingredients. And so it is. If you're going to have comprehensive, effective pain management, it needs to be just like the pie. And I call it the pain management pie. And it should be sliced with various different ingredients, injections, maybe steroids, therapy. And at the end, if you do not do better, with these conservative measures, then you may have to have a surgical consultation. But you want to make sure that you have exhausted non-surgical treatments before you seek surgery, not the opposite. So often people come to me after they have failed 4 or 5 surgeries, and they should have come to pain management early so that they could see if one of these slices or multiple slices of the pie would have helped them so they would not have to have had surgery. This is Dr. Bragg with a tip for a pain-free Friday, and I hope that you will review this video and get a very good understanding of what comprehensive pain management can do and how there are different slices, and that you make sure that you're doing what your grandmother would have wanted you to do, and that is putting all the ingredients in your pie. So please subscribe below.